Hey guys!
So today's weekly disease is coronary artery disease.
Coronary artery disease is a condition in which the arteries experience blockage. It affects the cardiac muscle tissue as coronary arteries, blood vessels that supply oxygen, nutrients, and blood to the heart, become inefficient.
It is caused when the interior of a coronary artery becomes damaged or injured due to many different reasons, such as physical inactivity or having diabetes. After the interior is injured, there are deposits of fat and plaque that accumulate at the site of damage. The accumulation of these deposits at the injured site is a process called atherosclerosis. When atherosclerosis occurs, it causes the arteries to become constricted and it decreases the amount of blood flow going to the heart. If these deposits ever burst, this can cause further problems since platelets, which are a type of blood cell, will arrive at the site of injury and clump together to repair the injury. Although this causes further blockage of the coronary artery and can further constrict the artery and decrease the blood flow even more going to the heart. This is a picture of a normal coronary artery, and this is a picture of a coronary artery which is affected by CAD, which is coronary artery disease, and it shows the deposits of fat and plaque that are affected and are present in the artery. Coronary artery disease can present as many signs and symptoms in a person. One of these symptoms is pain in the chest. A medical term for this symptom is called angina, and this usually spans over the time period of a few minutes, and it usually goes away in a while. This symptom also presents as a tight feeling or pressure in the middle of the chest or the left of the chest. Other symptoms of this condition are shortness of breath or extreme fatigue or tiredness after performing an activity such as jogging. One of the most extreme signs of this condition is a heart attack. A medical term for a heart attack is myocardial infarction. This sign can occur when coronary arteries are further blocked due to platelets and more deposits of fat, and this further decreases the blood flow to the heart, which can lead to a heart attack. This picture represents the process of how a heart attack occurs, and here you can see the plaque and the deposits of fat that are further blocking the blood flow to the heart.
CAD can be diagnosed using various methods. First, a physical examination and routine blood tests can often indicate this condition. However, diagnostic tests are even more accurate. These tests include electrocardiograms, echocardiograms, cardiac CTs, angiograms, and stress tests such as nuclear stress tests and exercise stress tests. An electrocardiogram checks for heart conditions as it records electrical signals running through the heart. An echocardiogram uses sound waves to record the pumping activity of the cardiac tissue. Exercise and nuclear stress tests record the blood flow to the heart while you're under stress and while you're resting. Lastly, a cardiac CT records the level of calciums that can often constrict and close your arteries. A high number may indicate CAD. Treatment and management of this condition, CAD, can be done in various ways. For example, lifestyle changes and drugs prescribed by a health official can often help treat and manage this disease. Healthier arteries can be promoted by eating healthy, losing unhealthy weight, exercising, quitting smoking, and reducing stress. Drugs include ranitidine that helps with uncomfortable pain, cholesterol-reducing medication that regulates the amount of cholesterol in your arteries, aspirin that can reduce blood clots, beta blockers that can slow heart rate and BPM, and nitroglycerin that can dilate arteries. All of these methods and drugs are very, very effective towards treating CAD and managing it. Here's a picture of people that are leading a healthy lifestyle by exercising.
There are also many risk factors that a person can have that can put them at a higher chance of developing CAD. Two of these factors are age and sex. Old age can put someone at a higher chance of having constricted or injured arteries, and males also have a higher chance of developing CAD than females. Although once females enter menopause, their chances of developing CAD also increases. A person also has a higher risk for developing this condition if they have family members who have suffered from this disease. Smoking and the inhalation of secondhand smoke can also result in developing this disease, since smokers already have a significantly higher chance of developing heart disease, and inhaling secondhand smoke can also have the same effects. A high blood pressure can also cause this disease, since a high blood pressure causes thick and hard arteries, and this constricts the arteries, which causes them to decrease the blood flow going to the heart. High cholesterol levels can also lead to this condition, since these levels put a person at risk for developing more plaque in their body. Being overweight or obese can also lead to this disease, although not directly. This risk factor doesn't affect the arteries directly, but it can make other risk factors worse. Diabetes, which is a medical condition that affects the blood sugar, can also lead to CAD since it presents the same risk factors that obesity and high blood pressure do. Other risk factors that can also put a person at risk for developing CAD are leading a sedentary lifestyle and having high stress levels. An unhealthy diet or bad eating habits can also lead to CAD, especially if the foods that are being consumed have excess saturated or trans fat, sodium, or excess sugar. This last point was highlighted in the slide before this. Here are some pictures of people who are leading a sedentary lifestyle.
How do you prevent it? Well, there are multiple ways to decrease the risk of getting CAD. First, you can maintain a balanced diet and exercise regularly by eating high fiber, low fat, low sugar, and low salt. Maintaining a healthy diet and exercising regularly can be one of the best ways to prevent CAD, as it keeps your blood pressure stable or below 140/90 and keeps your heart pumping. Second, quitting smoking and alcohol consumption is also very helpful, as smoking can lead to furring of the arteries, or atherosclerosis. On the other hand, drinking increases the risk of getting a heart attack. Both of these bad habits can lead to coronary thrombosis, which is a blockage of the arteries. So, by quitting these bad habits, you can significantly change the outcome. Then, keeping your sugar levels low is also very important, as high blood sugar can often damage your arteries and blood vessels, which are valuable. Lastly, taking prescribed medicine can also be very helpful with dealing with these symptoms. Sometimes that medication can even prevent heart-related problems and decrease the symptoms in the future. In conclusion, all of these factors play a huge role in decreasing the risk of CAD, or coronary artery disease. Here's some medication which says RX on it, meaning prescribed. You should only take prescribed medicine.
Some statistics about heart disease in the United States of America is that heart disease is one of the leading causes of death. Every 36 seconds, one death occurs due to cardiovascular disease, and this type of disease also causes 655,000 deaths annually.
1 out of 4 deaths is due to heart disease. CAD is very common, as it killed over 300,000 people in 2017, and 6.7% of adults older than 20 have CAD, and it causes about 2 in 10 deaths of people under the age of 65. Make sure to subscribe and press the bell icon so you can know when we post another one of these very, very interesting videos.
Also, make sure to like the video.
Thanks for watching.
See you next week with another interesting disease. Bye!
P.S. We used a lot of good sources and images, so all of those citations are down below.